Clear signs you are on the wrong diabetes medication. Do you ever feel like your medication is doing more harm than good? Particularly if you have been diagnosed with diabetes, the wrong medication can lead to a host of chronic problems. But how do you know you are on the wrong medication? It is really not uncommon, right, for doctors to prescribe medications without really fully informing their patients of potential side effects. But it's important to recognize when a medication isn't working for you, so you can actually communicate with your doctor and say, hello, can we find an alternative solution, please? Don't suffer in silence. Pay attention to the signs and speak up if something doesn't feel right. Your health is way too important to ignore. Today, we are going to talk about the signs that if you are on the wrong medication, you will know. Now, some of these medications do not even help you much, and you're like, well, I've been on this for 20 years, I don't know if it is doing anything. Well, number one, if you are frequently experiencing urinary tract infections or feeling excessively thirsty or dehydrated, it is possible that these issues could be related to certain medication class. We call them SGLT2 inhibitors. Now, some commonly prescribed medications in this class are Jardiance, Farxiga, and Invokana. While these drugs have some benefits, they have beneficial features for certain patient populations, they are not without potential side effects. So if you're experiencing these symptoms I just told you about, and you're on one of these medications, maybe it is time to discuss with your doctor to determine the best course of action, to stop it, change it, lower the dose, whatnot, whatever, right? Don't suffer in silence, seek help. Number two, constipation, super common problem. So if you are one of those many people dealing with chronic constipation, you may have turned into GLP-1 agents for some good reasons, right? A lot of you are taking Trulicity, Ozempic, Mounjaro, Victoza for some relief for weight loss or diabetes control and whatnot. While these medications can be effective at reducing the appetite and managing diabetes, they do come with some risks, like constipation, because they introduce these supraphysiological doses of hormones, meaning that, if your body is making one of these hormones, these medications are giving you 10 of these hormones, right? It's supraphysiologic. They will have negative effects sooner or later. There is some evidence to suggest that, these agents we just said can cause thyroid or pancreatic cancer if you are prone to it. On the other end of the spectrum, these medications can also cause diarrhea because it messes with your GI system. So it can be as unpleasant as constipation. So who wants to live in the bathroom, right? So if you're taking these medications and experiencing these GI side effects, again, tell your doctor how to tweak the medication, or if necessary, stop the medication. And let's not forget the metformin, right? It can cause chronic diarrhea. So be aware of the possibility as well that if you're on metformin, sometimes years later, you may end up with chronic diarrhea because of metformin. Just because it didn't cause the problem. Same thing with Ozempic or Trulicity. Just because they didn't cause constipation at the beginning doesn't mean that they will not. They will eventually, sometimes, not all the time, but will cause problems. So don't be surprised. Now, if you're feeling constantly tired, you have headaches, you're dizzy, you're sweaty, you might be suffering from some low blood sugars, my friend. And it can be due to sulfonylurea agents, and these are glipizide, glimepiride, glyburide. These are very common medications. You may be simply just way too over-medicated, and it's very common. Now, if you are having swelling in your body or excessive weight gain, despite the blood sugars getting better, could be a sign of the side effects of these sulfonylurea agents. Now, weight gain and swelling in your body can be incredibly frustrating, right? Especially when you're trying to manage your blood sugars and you keep gaining weight. So if you're experiencing these symptoms despite working really hard to maintain a healthy lifestyle, it is possible that the medication you are taking could be behind it all. there's a medication, for example, that can cause all these problems too, except the low blood sugar. But swelling, like I said, and weight gain can happen from Pioglitazone. So it can be effective in helping the blood sugar, but it can cause a lot of weight gain and swelling in a lot of patients. So if you are having this excessive, uncontrollable weight gain despite your blood sugars getting better, it may be worth considering switching to an alternative treatment option under the guidance of your doctor. We have a lot of patients who take our supplements and they are super happy when it comes to managing their blood sugar. So check SugarMDs.com. But don't feel discouraged. There are options out there. Like I said, there are supplements you can consider, but you need to educate yourself, discuss with your doctor, see what's best for you. Now, another problem that people get, and they don't even realize that it is because of the medication, is neuropathy. Now, tingling, numbness, it can be very unsettling, sometimes painful. Many people does not really realize that these sensations could be a result of taking metformin for long-term, causing B12 deficiency. So it is a reversible type of neuropathy because if you replace B12, your neuropathy will get better. So instead of suffering in silence, again, it's crucial to, at least if you're going to stick with metformin, to take B12 replacement, or at least check your B12 levels to make sure that you're not deficient. Now, remember, health is wealth. Don't be cheap on your health. Take care of your bodies. Make sure it's a top priority. Just because a medication is cheap, don't suffer the side effects. Now, last one is an easy one, right? High blood sugar is not coming down. So if your blood sugars are not coming down, and you've been diligently taking your medication, eating the right foods, exercising every day, but your blood sugar continues to remain high, well, you may be on the wrong medication or the wrong dose. Because a lot of people will come and say, oh, this medication didn't work for me, or this supplement didn't work for me. Well, how did you take it? Because every medication or supplement will work depending on how much you take it and depending on how long you take it, right? So you have to be sometimes be patient, especially with this new glucodefense we have. It takes 6 to 10 weeks to see the results by taking 2 capsules twice a day. So look into that, but you have to be patient with the glucodefense supplement. At the end of the day, if your blood sugars are not coming down, talk to your doctor. Don't say, well, after, let's say you tried a medication for a month or 2 or 3 and nothing is changing, it may be time to add or remove something from your regimen. A lot of times people combine the medications and supplements, especially if the supplements are food supplements like we have on SugarMDs.com. I don't see any problems with taking it with the medications as long as you're coordinating with your doctor about your blood sugars. If your blood sugars are going too low because you're taking other supplements, then you have to ease on those medications and cut back on the medications under the guidance of your doctor. So, when dealing with management of diabetes or managing your diabetes, it is really essential for you as a patient to have a clear understanding of the medications you're taking and their side effects, and know when you are on the wrong medication. It is really not uncommon for people to become overwhelmed by the amount of medications that they're taking, and this can really have a negative impact on their overall well-being, psychologically and physically. Now, one way to alleviate this burden is, again, going back to what the nature gave you. By doing so, you can greatly reduce the amount of those medications that you need to take that can eventually lead to poor quality of life if you continue to take the wrong medication that is not really helping you. If you're looking for a safe and effective supplements or diet, check out SugarMDs.com. We offer free books. Take advantage of that. We have the Ultimate Diabetes book, which is a totally large book, like an encyclopedia that you can find everything in it. We have a new book that is available as of, what is it now? September. So we are in September, middle September. It's available as an ebook, but it is coming as a print book in the next few months. But you can sign up right now, get your free ebook, and then later get your free print book as well. Anyhow, that is it for today. Well, thanks for watching until the end. Please share, please like, and please subscribe to our channel and spread the word. Thank you. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.